Good afternoon, and welcome to the Geriatric Practice Leadership Institute, or GPLI, informational webinar. This webinar is from 12:15 p.m. to 12:45 p.m. Please keep all questions saved until the end, and we will show you how you may ask a question. During the webinar, you are more than welcome to post questions on the question sidebar on the webinar tool. Please keep in mind this webinar is being recorded.
So good afternoon, everyone. My name is Diane Hawley, and I'm coming from Texas Christian University. I'm the Associate Professor of Professional Practice there. We want to tell you about this grant that we have that is named WeHail, and that is an acronym that stands for Workforce Enhancement in Healthy Aging and Independent Living. This is a grant that is housed out of UNT Health Science Center, and it's in collaboration with JPS, TCU, and the United Way's Area Agency on Aging. And it is a grant that was awarded to us from HRSA. HRSA is Health Resources and Services Administration, and it is a division of the Health and Human Services Department with the federal government. This grant is intended to develop or enhance programs focused on improving outcomes for older adults. So with that in mind, we have one initiative of this grant is the Geriatric Practice Leadership Institute, or abbreviated GPLI. And this is one innovation of the 5 innovations of this grant. And this particular innovation, this particular Leadership Institute's purpose is to equip individuals and interprofessional teams with population health and aging network and leadership skills and knowledge and experiences. And our intent of equipping the teams and the individuals with this information is so that they will go back to their institution, their organization, their place of practice, and develop, implement, and evaluate a quality improvement project there. So this institute has a curriculum, and the curriculum has 5 concentrations. The first concentration is population health science, and we believe that one of the things that made this grant impressive to the federal government is the fact that many healthcare practitioners that are in practice today do not have a good understanding of population health, mostly because that concept wasn't taught in healthcare education in the good old days. The second concentration is leading self. And remember, this is a leadership institute, so we're going to concentrate on leading yourself, leading teams, and then, very importantly, leading organizational change. The last concentration is also another reason why we think this was interesting to the federal government, and that is that we are also going to concentrate on the aging network and the healthcare delivery for older adults. And those are the 5 concentrations for the Leadership Institute. The overview or the details of this institute is that we will have, it is an institute of 10 months. It begins in September of this year, and it will end in June of 2017. And this first cohort will be our inaugural cohort. We're hoping to do this for many more years to come. But the first cohort will have 6 to 8 interprofessional teams, and in those teams will be 3 to 5 participants per team member. The time commitment is 3 Friday-Saturday sessions during the months of September, October, and November. And our intent there is to front-load the team and front-load individuals with information about all these things that we have been talking about. And then 2 sessions in the spring, summer of 2017. Another time commitment that we're asking for with this institute is in-person and or virtual sessions with coaches or mentors. This Leadership Institute will assign each team a few coaches / mentors that will help the team brainstorm, problem solve, work toward negotiating things, cheerlead the team forward so that the team doesn't become stagnant in that 10 months. The coaches / mentors are going to be representatives from Texas Christian University. We're very proud that the Neeley School of Business, the Executive Center, is participating in this grant, and they are one of the premier business schools and leadership institutes in the United States. UNT Health Science Center will have coaches and mentors, JPS as well, and the United Way's Area Agency on Aging. So we feel like we will have a quality coach/mentor team to help these GPLI teams. What are the benefits, or what's in it for you and your team? Well, we tried to spell out what are some of the benefits, and certainly developing exceptional leadership skills and knowledge. We also believe that expanding the leadership role and responsibilities within your organization and the community will give a greater impact to geriatric care. We also believe you'll have quality training from highly respected professionals from both two universities, UNT Health Science Center and TCU, as well as from the community in the United Way's contributions. You'll receive personal assessment and individual development in these leadership skills and knowledge. Another benefit is that you'll learn how your individual leadership styles impact others in your team and within your organization. You'll get some great ideas about other innovative ideas and programs in geriatric care throughout the country and maybe even throughout the world. Network and build relationships with respected leaders in geriatric community. That is a very important thing that we feel like the Institute will offer. And you'll get to have an enhanced appreciation for the health needs and deliver improved care and services to this population. Last but certainly not least is you'll receive a GPLI certificate of participation from TCU's Neeley School and Harris College, as well as UNT Health Science Center. This is important because these are the dates for the sessions. Certainly the fall dates have been set, but the spring-summer dates are tentative. The fall dates are Fridays and Saturdays, again, Friday and Saturday in September, Friday, Saturday in October, and Friday, Saturday in November. The Friday, Saturday in September is September 23rd and 24th, and these are 2 full days, 9 to 4 time periods. The session in October is a half day on Friday, 4 to 8 p.m., and all day on Saturday. The session in November, November 11th and 12th, is half day on Friday, 4 to 8, and all day on Saturday, November 12th, 9 to 4. There's 2 follow-ups. Again, we front-loaded the content, but we have coaches and mentors there to help you and to move your team along and move your organization along with this quality improvement project. So our tentative follow-up date is in May, Friday, May 5th, and that would be an all-day session, as well as the final presentation is looking to be Friday, June 16th for half a day in the morning. Now again, I talked about the coaches and mentors and the fact that the coaches and mentors are hoping and intending to go to you on site and some virtual consultations, and we're looking to have those accomplished during the months of November, December, January, February, and March, April. And certainly the length of those sessions and the locations will be decided mutually between the members of the team and the coaches/mentors. The fees. GPLI's fees, we have estimated the cost to be approximately $2,200 per person. Now, because this is a grant by the federal government, those fees are waived for the 2016-2017 inaugural year. So you can agree, I hope, with me that that is a good price to pay, $0, for this very fine Leadership Institute. Now, certainly travel and lodging is not included, and we are looking to apply for and get permission to have continuing education credits for the various disciplines within the healthcare professions.
All right. I am Alexander Cisneros, and I'm going to do the rest of the presentation, and I am actually from the United Way's Area Agency on Aging. We'll be going into more detail about the actual application process. So we are going to talk about 3 different eligibility requirements under the application. The first one is for a team member, the second one is for the team, and the third one is for the leadership or the sponsor of the organization or the organization as a whole. So the first one is the members' eligibility requirements, and we are asking for a 2-year experience in geriatric, also a formal or informal identification of yourself as a leader. We are willing, if you are willing to also sign a GPLI agreement and also attach a resume. So that is the requirements for each team member. As a team, you'll have to do an application, and one of the requirements will be a letter of reference from your leader or your sponsor agency or organization. Also a completed application that includes the names of all your team members. And the last eligibility requirement is the team project and a description of it. So the eligibility for the leader or the sponsor of the organization includes the acknowledgement that release of time for all the attendees, also to ensure that your team project that is chosen has been vetted and is relevant to the organization, and finally that you support the team's time commitments and implementation of the actual project. So what is a team project? Well, our hope is that each team will work on a quality improvement project related to at least one of the 5 areas that we have addressed here. Those areas include health literacy, chronic disease, falls prevention, medication management, and dementia care. However, these are really broad areas, and we understand that some projects might fall under different aspects of it. For example, if your project is related to advanced directive, that would easily fall under dementia care. It could also easily fall under chronic disease. So now we're going to talk about a little bit of a project example. And again, this is just an example that we wanted to share with you guys to know what you should be thinking about when completing this. So our project example is involving health literacy. And some of the questions that we really thought about asking ourselves as we described the project is, why is health literacy important to understand in older adults? Well, the Institute of Medicine reports that 90 million people, near half of our adult population, lack health literacy skills to understand and act on health information and health system demands. So what can my organization do to impact geriatric care and improve health literacy? Well, more and more we're hearing about moving from crisis care to a preventive care, and obviously health literacy is a very important part of that transition. So what kind of impact could this project really have in my community? Well, we are thinking that an example would be a patient's medication states that they cannot take the medication with a meal. Does the patient know that that means first thing in the morning on an empty stomach, or do they think, oh, well, I haven't eaten a meal, so I can take, my, even though I've had breakfast? Those things are obviously really important to interpret correctly and to know that the effects of misinterpretation of medication labels is important. So a potential project that we have here is to develop an assessment process for all older adults utilizing a Agency for Healthcare Resource and Quality Health Literacy Universal Toolkit, and to really design it for the primary care practices. And obviously, this can provide evidence-based guidance to primary care practices and ensure that the systems are in place to promote better understanding by all patients. So the actual sections of the application include 3 parts: an individual application, and as Diane said, of 3 to 5 members maximum, a team application, an organization or leadership or community sponsor endorsement. The individual application portion has 3 sections. Section A is the personal information. That includes just demographic information, also your contact information and things like that. Section B is an attachment of a resume or a CV. And then the final section is a memorandum of understanding. And that's really just a signature acknowledging that you agreed to the time commitment of the actual institute, to notify in advance if you are unable to attend to any sessions, and also to notify GPLI of any employment status that you have that will change. The team application has also 3 sections. The first one is team information. That's really just the team members' names. Section B includes the organization or community information. So general information about your organization or who you're representing. Section C is the description of the proposed quality improvement project. So we want a little bit more detail about what you're thinking, and we are suggesting some of the questions that you need to ask yourself are, what is the problem? What specific population is impacted? What kind of improvement does the team envision? And how do you apply those improvements? And what kind of outcomes you're expecting out of this? Is it related to cost, quality, and access of care? And then the final section of the application is the organization or the leader of community sponsor endorsement. That includes, again, the person you are assigning as your leader or your sponsor of your organization, the team information, which includes everybody's name, and the last section, which is the memorandum of understanding, acknowledging that you are allowing people to work on the GPLI, and also that you will notify us of any commitment changes or employment status. And again, the letter of support that was previously mentioned. So what will be the next steps after an application has been submitted? Well, after June 1st due date, the applications will be reviewed for relevance, impact, and completion. The teams will be selected and organized and will receive notification and more information by July 1st. So now we're going to be doing a brief introduction of all of our teams. And Diane, do you want to start?
This is the TCU team, and as you can see, 4 out of the 5 of us are from Neeley's Executive Education and Neeley School of Business. So we're really proud of these faculty, and they are the premiers in understanding and talking about leadership skills.
The next is the UNT Health Science team, and it includes Dr. Kniebel, Jennifer Severance, Dr. Thomas Fairchild, and Dr. Brad Cannell, also Caitlin Camp, sorry. The third team is the United Way's Area Agency on Aging team, which is represented by myself and Dawn Smith, the Director of the Area Agency on Aging. Okay, so when is the application due? The application is due June 1st, 2016, and the applications can be completed and they're online, so you can go to the website. It's unthealthsciencecenters.edu/GPLI. And the contact person for any questions that you might have about the application is Dr. Jennifer Severance. Her information is on the screen as well. So now we are going to open it up to questions. And Subhita, can you just let everybody know how exactly to ask questions?
Yes. So if you would like to ask a question, there is a button that says raise your hand. In the picture, it's identified by the arrow. If you have any questions, please click that, and then I can unmute you. It will send you a code, and you will just type that audio pin into the phone. Does anyone have any questions? Okay, looks like we have one question. This is from Ellen Munsterman. The audio code should have been sent to you.
Can you hear me?
Yes.
Yep.
I just wondered if there was a browser that is preferred for the UNT website, because we've tried it here at THR and have had some difficulties with being able to see the application and all of that. We have to scroll very far down on the website. There seems to be a lot of blank space.
What browser are you using?
Internet Explorer.
Okay, possibly Firefox or Chrome. I have not looked at it on Internet Explorer, but I will take a look and I'll ask our IT department to see what they can do to help.
Okay, thank you.
You're welcome. Do we have any other questions? This can be related to any feedback for how the information was delivered, if there are still any questions you have about the application process or any such questions. You can also post the questions on the question box on the side panel. So it looks like we have one question posted. Why do we have to apply as a team?
I would say the reason for the team is because we feel like 2 heads are better than 1, and certainly 3 to 5 individuals that are in leadership roles already working together on a project could make for the biggest impact. And we're looking for a big impact with this. Certainly where our hopes are for your organization that you get a very big impact, and we think that if you work as a team, you can spread that impact out through your organization in a bigger way than an individual would be. I also want to address, as long as I'm at it, to talk about why interprofessional. And we feel like, again, we want people to get out of any silos that might be occurring and work together interprofessionally. Again, we feel like there is much more of a possible impact when groups of various disciplines work together for a common vision and a common cause. And what interprofessional means by the World Health Organization is 2 or more professions. So I think that's kind of going to be our definition for how we would handle interprofessional.
Thank you. Looks like we have another question. Jennifer Severance, the audio code was sent to you.
Can you hear me?
Yes.
Okay. On one of the slides it mentioned population health and aging network as topics that are going to be a primary focus. How does that relate to the Leadership Institute?
Okay, so we know that most of us have been educated as taking care of individuals. And so our hope is that we can look at it from a broader perspective and more upstream thinking, that prevention could be an answer to better geriatric care. And so when you look at prevention and you look at upstream thinking, then you're in the world of population health, and certainly the Aging Network helps us look for those answers and looks for that impact. This grant also has a slant toward community care and primary care. And so our ideal team would be coming out of the community or primary care setting rather than the hospital setting. And that is a request for the federal government by the grant.
Thank you. We have one question that was posted. My organization has 2 possible teams. Is this okay? And what happens after we submit our application?
Yes, 2 teams are perfectly fine as long as there's 2 applications submitted for the teams. What will happen after the application, it will actually be submitted and reviewed by the team at GPLI for relevance, and it will be, again, it will be selected once that process is completed.
Thank you. Are there any other questions from the audience? Looks like we have one question. If our team members represent more than one organization, how should we address the sponsor letter?
I think what I would say is due diligence, and our sponsor, the leader sponsor letter, is intended to make sure that the organization at the highest level possible is aware of this program and is supportive of this program. So if that's 2 people, then great. If that's 1 person, then great as well. All we ask is that you make sure that the powers that be within more than one setting, if that's the case, that know that and are very supportive of this particular institute, and you're being a part of this particular institute.
Thank you. All right, and we have another question. What if we have questions about our team project to list on application?
Ask that again, Sapita.
What if we have questions about our team project to list on the application?
Certainly, if you have questions, you can certainly contact Jennifer Severance. You can also contact Alex or myself, because we can certainly answer some of those questions. Ideally, I want everyone to realize, even though you are submitting a project idea, it is really that. It is an idea. It might morph into some other slant or some angle that is certainly relevant and important and impactful for you all as a team. But I don't want anyone to be wedded to the exact things that you are saying in your particular project idea submission. Does that answer the question?
Yes, it does. Thank you. Do we have any further questions? Looks like we do not have any further questions. If you would like to email us any questions you may have later on, please contact jennifer.severance@unthsc.edu. The recorded webinar, along with the FAQs, will be posted online at the unthsc.edu/GPLI website. On the next slide, you will see the contact information if you do have any questions or further feedback. Please remember that the applications are due by June 1st, and all the information is available on the website. We appreciate your time and hope you all have a good rest of the day and good weekend. Thank you.